morning.
Good morning.
To some of my favorite people throughout the city of Baltimore, it is always so good to be here. And you all know I visit here often, but it's so great to see seniors gathered. Y'all do some wonderful things here at this center, and we keep growing and expanding and offering opportunities to help improve the lives of our seniors. I understand that there's a new senior building that's going to be built right across the street. But that's not why we're here today. Today we're here to talk about a program called TIPS. It's Telehealth Intervention Program just for our seniors. I tell folks, I don't care how old you are, even when you're born, we're all seniors in training. Our prayer is that hopefully we all get there, that we get to live the lives that you all are living, and that our lives improve in this city as a result of the work that we will continue to do on your behalf. And I have to say that Dr. Leanna Wynn really takes the lead in terms of someone who is committed to the lives of our citizens and really committed to the lives of our seniors. And to Dr. George Hanawi, he's the Director of Geriatrics, MedStar Good Samaritan Hospital. Thank you also for all the work that you do. As you may know, TIPS, as we call it, began operating in this center, the Zeta Center in West Baltimore. And it is a collaboration between MedStar Hospital Center for Successful Aging, the Westchester Public-Private Membership Fund, and the Baltimore City Health Department. This is a national program. It actually started in New York, but we believe that this is a program that will make a difference for our seniors. And just in a short period of time that participants have been working with this program, it has reduced, you all, emergency visits by 35%. That deserves a round of applause. And this is compared with just 12 months ago, where 78% of the Zeta Center participants have had one or more chronic conditions. So far, the program has enrolled some 78 participants. You all go out there and get some more for us. At the Baltimore site, MedStar is working with student interns. They provide regular remote nursing monitoring, vital sign tracking, and diabetes and heart health education. The health department screens for eligibility for benefits and resources, and educates our seniors about all of the programs as it relates to how you manage chronic diseases. Again, I want to thank Dr. Wynn, but I want to thank you all. I want to thank you for participating. And because of your participation, it allows us to continue to improve these kinds of programs. You know we have physical activities going on here. So how many people get up at least do something physically? Wow. So this morning I left my house at about 4:45 a.m. Where I run every morning. But you know, it's not just about running, it's about walking, it's about moving. And so I need you all to continue to move, do something every day, lift your hands up, stretch your arms out, and walk. And again, it makes for a healthier lifestyle, and we're so glad that you're in this program. Our goal is to continue to improve it, more importantly, to expand its participation. With that, let me welcome to the mic Dr. Wynn.
Well, I am so glad to be here with all of you, and every time I speak and see Madam Mayor, I'm just so inspired by her vision and leadership. Mayor Pugh, as all of you know, she's been a lifetime champion for older adults, and also she is a personal role model for so many of us on how to live healthy and active lifestyles. Getting up at, I hear 5 a.m. in the morning to go running.
4:45.
Oh, 4:45 to go running.
Out the door about
Wow.
Out the door.
Out the door, she says. So a lot of a big inspiration for all of us, definitely for me. So TIPS, as you all know, is the Telehealth Intervention Program for seniors, and it exemplifies two core principles in public health. First, TIPS goes to where people are, bringing healthcare out of hospitals and into the communities where people are. Second, TIPS focuses on prevention, because we don't want to wait until somebody is so sick that they have to go to the ER or be hospitalized. Instead, it's about treating illnesses early, detecting them before they become a problem, and also preventing them ideally in the first place. So I want to thank our partners for making this possible. Please join me in giving a round of applause to our host site, the Zeta Center for Healthy and Active Living. And it's going to take a while to get through all of our thank yous. So I will say after we applaud the Zeta Center, we will hold our applause until the end. Betsy Simon from ZHAP. We have the Weinberg Foundation for helping with the expansion of this site, and Earl Millett is here with us today. MedStar Good Samaritan Hospital, George Hanawi, Dr. George Hanawi, you will hear from shortly, who is the Director of Geriatrics there. Dr. David Sachs and Mr. John Migliacci, and then Migliaccio and Colette Phipps, who are here from the Westchester Public-Private Partnership. They were the founders of TIPS back in 2014. Then we have a representative from Councilwoman Middleton's office, who has been a strong champion for us and also is on our Commission for Aging and Care Services, and that's Mr. Ginyard. Thank you very much. Then, of course, I would be remiss to not acknowledge our team here at the Baltimore City Health Department: Young Tan, Deputy Commissioner, Eloise Main, Natasha Ramberg, and all the members of our Division of Aging and Care Services, and the commissioners also who are here as well. So Mayor Pugh described a bit about how this, what we call this high-tech, high-touch model works, which is that we meet people where they are, where they feel at home. For example, the Zeta Center. The clinical staff from MedStar provides remote nurse monitoring to check vital signs like blood pressure, heart rate, and weight. And the information is monitored and tracked and uploaded into the hospital system. Depending on the results, we may link people to a healthcare provider if that person needs to be seen soon. But many times, people don't need to see a doctor immediately, but they might need health education. For example, patients with diabetes or heart disease may need education about the best type of diet to follow. If a participant needs additional assistance, for example, with social services like housing or other benefits, we will then help to link them up with those benefits as well. And then we follow up with them to make sure that they're making progress. And importantly, we track their health indicators so that we can see in real time if people's health status are improving. Mayor mentioned that since the launch of our program in April, nearly 100 people every week come here to check on their health and, importantly, stay out of hospitals. TIPS is a simple program that makes a big difference because chronic diseases like heart disease, hypertension, diabetes, they are the leading causes of hospitalizations and deaths in our city, in Maryland, and around the country. So this program helps us to catch these potentially life-threatening developments early, with the goal of keeping our seniors out of ERs, out of hospitals, and to stay healthy and live active lifestyles at home. So I'm really glad that under Mayor Pugh's leadership, we've brought this important national program to Baltimore City. It's the mission of the Baltimore City Health Department to protect the health and well-being of every resident here in the city, and older adults who have made such a big difference for all of us deserve only our best. So I now have the pleasure of introducing a key partner in our work, Dr. George Hanawi, who is the Director of Geriatrics and the Director for the Center for Successful Aging at MedStar Good Samaritan Hospital. Dr. Hanawi.
Thank you so much. Good morning, everyone. What a great day. So great to be here with you, and I appreciate the opportunity to be here with you today. I want to start by thanking our Mayor Kathleen Pugh, for her leadership and commitment to older adults in our city. And feel free to clap. I have few people to thank. And I want to thank also our Commissioner, Dr. Nguyen. Without her vision and support, we won't be here today. So thank you so much for all that you do. There's a lot of folks on my list to thank. I want to start by thanking you all for being who you are and committing to the program and other wellness projects that you have done. Thank you so much. I want to take the opportunity to thank my team. They're sitting here. It's Carolyn, it's Sean, it's Linda, and I know Jada, our nurse, is here, but I don't see her. Thank you for all what you do. Thank you. I want to pick up where Dr. Nguyen left. Older adults deserve better care. I'm going to share with you a few numbers about the state of elder care today. 1 in 5 older adults get re-hospitalized within 30 days of being discharged from a hospital. Actually, that number is close to 1 in 4. A senior with complex chronic conditions like diabetes and blood pressure will have 36 visits to 14 different doctors and get prescribed 50 medicine within a year without access to proper care coordination. And folks, this is not acceptable. This is not what we owe our older generation. We owe them better. And we are going to deliver better care than that. We set out in 2012 at MedStar Health to change the way we care for older adults in our city. We wanted to provide a proactive, person-centered care delivered in the community, not in our hospitals, to allow people to age in place. And we knew we cannot deliver this in the silo of our hospitals. That's why we started looking for good partners in the community, and we could not have found a more perfect fit than the Baltimore City Health Department team. Where are they? Ms. Stan, Ms. Sternberg, Dr. Wynn. It was a perfect fit. It was an alignment for a common purpose, which is improving the quality of care for older adults in our city. Through this alignment and through this relationship, we were able to be introduced to this great center here, the Zeta Center, and the great people of the Zeta Center. We were also, yes, absolutely. Yeah, go for it. We were also introduced to the Weinberg Foundation, a great ally of elder health in Baltimore City, and the TIPS team, great innovators in telemedicine and telehealth for older adults. This collaboration led to the establishment and getting off the ground the project of TIPS here at the Zeta Center. But I want to tell you that we're already in discussion of establishing another center to serve more older adults in our city, and you will hear about it hopefully soon. I want to thank you all for being here. I'm honored to serve the great people of Baltimore City, and I promise you we will not stop till we touch the life of every senior in Baltimore. Thank you again.
Again, let me just say thank you to everyone that's here, to our health department, to our hospital partners, and to all of you. But I want to go back to 2014, I believe it was 2013, 2014, I believe, is when we first passed telemedicine legislation in the state of Maryland. I was actually the senator at that time who led that legislation. And the discussion was that we really didn't need telemedicine in the urban environment. And telemedicine was being talked about in terms of the lack of availability of hospitals and doctors in rural counties. And I took charge of the legislation and led that legislation because I said, you know, we deserve to have telemedicine availability in our city. And reason being is for the very purpose that you are here today. Because now we're able to expand our services to seniors. You don't have to rush to a hospital. You can check and be in contact with someone via telemedicine. This is what it's all about. And when we talk about the future of telemedicine, and I'm speaking at the Science Foundation about how we even look at drug treatment, Dr. Wynn, as it relates to telemedicine. We can transform our communities, transform our neighborhoods, and improve the health and well-being of the people who live in our cities. So again, thank you all for being such great partners and great participants. But again, thank you to all of our partners for making this possible. We appreciate you all. Thank you.